My name is Hilary Kururajire. I'm the country youth leader to the United Nations. I'm going to ask each of the panelists a question, and each of the panelists will respond to that question in 5 minutes. And I'll do a follow-up question or questions for more 5 minutes, after which I'll open it up to the audience, and they will ask questions that will be answered by the panelists for exactly 5 minutes as well. So each panelist has a total of 15 minutes. Winnie, given that you're the program's manager with Reach a Hand Uganda, I'm very sure you're well versed with the current status quo of the universal health care coverage in Uganda. And my question to you, what is the current status of youth involvement in the UHC agenda in Uganda?
What I'm talking about is that from the national level, I guess they're consulting with a couple of people. Different organizations are sitting on different coordination committees. However, for us, it's quite pertinent that we involve very many other young people, not only the people within the areas, the town areas, but also young people who are in hard-to-reach areas. It's important to note that different people have different needs, health needs, not in the sense that they are so diverse, but what a young person in a rural area faces is different from what a young person in an urban area faces. And it's quite important that all voices are merged to bring the agenda to fruition. Uganda is doing well in regards to budgetary allocations, not quite as much as we expect, because it's not even 5% of it's not 5% of the budget. Uganda comes below a number of sectors, be it the infrastructure sector, be it energy sector. And if all of us know the truth that universal health coverage can't be attained if public expenditure to the sector is less than 5%, which is what it is. So beyond how young people can be engaged in universal health coverage, how do we leverage the different opportunities like this platform to get government to listen to us? Which policy, how do young people meaningfully engage so that when they bring their suggestions to the table, they are upheld by the different stakeholders? A lot of times when we sit on these tables, people will say, oh, young people just know how to make noise. Young people don't have evidence. So how do we get young people who have the evidence, and not evidence based on hearsay, like, oh, I went to my village and only 2 girls were pregnant, because that's the stance that most of us approach health issues in this country. Unless it's on the door, our doors, we don't know the plight of very many young people outside our confines. So how does the evidence that is there, how do youth lead the process of attaining certain evidence to bring to the table for policymakers to take into consideration? Teenage pregnancy, for instance, we know we know that it affects a certain demographic, and demography means age, location. Rural areas are more affected than Uganda, but which services are there? Which services are provided for young people to get health care? One of the reasons that young people have fronted is that they do not have the money. And this is one of the things that the universal health coverage wants to eliminate, so that people have access to quality care, but also at a very subsidized or no cost. But as it stands, this is not the case. And in the morning, the minister said the strategic documents speak to this. But for how long will the strategic documents speak to this universal health care? For instance, the bill, the National Insurance Bill, has been on the floor of Parliament since 2012. It's 2019, we're going to 2020, but the universal bill is still in cabinet. How long do young people have to wait? The average young person in this country is a 15-year-old girl, and we know the problems that young people face. The dependency ratio is really high. Definitely young people can't afford these services. We know for sure that one of the other issues that is fronted by young people is distance to health facilities. young girls everywhere have to walk distances to access certain facilities, be it at the health center 2 level, be it at health center 3, and Uganda's referral system works like that. You have to move from this point to the other point. At the end of the day, it's at the national level. But how do young people know that this is the roadmap that you take if you want to receive services? We see a lot of young people come to at Mulago Hospital waiting for services, and yet they're supposedly supposed to be at a certain part of the health system to gain this, to get these services. That notwithstanding, supply of medicines, this is not decentralized like health services. It's one thing to have health services at the different parts of the country, but it's another thing to have these drugs come from the centralized system to reach the young people at the grassroots. We have, there have been reports saying there have been drug stockouts, and this is a fundamental issue that's affecting, and that is going to jeopardize us reaching universal health coverage. Access to drugs, distance to hospitals, and the mere fact that young people are not meaningfully considered when these decisions are being made.
Thank you very much, Winnie. You still have the mic because I'm going to ask you a question. That has really been quite a presentation as you give to us the current status quo. And I indeed like it when you say such platforms are the best platforms that we need to ensure that the youth voice is indeed heard and we are listened to. My next question is going to be more of solution-oriented because my previous question was more to get to know where we are today. And my next question is, given the challenges as well elaborated by you, what should be done by the stakeholders and the youth, we as the youth, to ensure that these gaps are closed and we have more youth inclusion in the UHC agenda?
For me, one of the solutions or one of the fundamental issues here is for different stakeholders to acknowledge what young people bring to the table. It's unfair that young people are looked at as a bunch of people who only want to get and never give, but we have a lot of talented and well-experienced young people on different platforms who can be leveraged to have discussions like this. The other issue for me, and what is also important, is evidence. How do different stakeholders build the capacity of young people, especially in the health sector? And this is not about doctors, this is about policy enthusiasts, this is about researchers. How do we build this capacity? And we don't want to have the 15 years experience line thrown at us. How do you build young but meaningful talent? There are very many platforms that people are using. Youth for Policy, where they're teaching young people to deal with these evidence-based issues. We have the Peer Educators Academy, where we get young people who are fresh out of school, but who have the desire to make change in their community. How do you grab them young so that they know what to do? Health is a very broad aspect. Let's not limit it to HIV/AIDS, and especially for reproductive health, which is one of the fundamentals and pertinent also to the demographic makeup of this country. Reproductive health is important. How do we acknowledge that this is an eminent problem that is facing young people? Let's not put our heads in the sand and say, oh, young people's morals have been degraded. How do we identify that these are really issues that are on our doorstep? I've looked at different documents, basically the National Development Plan to even the statistics from UDHS, and people limit the description of sexual reproductive health to HIV/AIDS and maternal mortality. But this thing is broad. How do we ensure that girls stay in school, do not get pregnant? And the how is what we can discuss, but how do we bring this to the table? For me, it's improving the capacity of young people. That's very important, and also acknowledging the fact that young people have something to bring to the table. And for me, that's what will at least push us in the right direction.